the director of Emory's Palliative Care Center. And this morning she's going to be discussing the connectedness of patients and families, given the new visitation policies that we have in place. And once again, if I could ask everyone to keep themselves on mute. We will take questions following Dr. Quest's comments. And if you could enter your comments into the chat, we'd appreciate it. All right, I'm going to turn it over to Dr. Quest. Good morning.
Thank you. Thank you. Good morning, everyone. So my sincere pleasure to be able to talk with you this morning a little bit about what our patients and families are experiencing during COVID-19. As many of you know, many of the hospitals and most of the hospitals in our nation who are taking care of patients with COVID-19 or suspected COVID-19 have instituted a number of visitor policy restrictions. With those restrictions, what we know is that patients and families are separated in a way that they've never been before. What we know is that it is imperative that we do have these visitation policies that restrict visitors to hospitals such that we are able to contain the transmission and I would say stop or distance our own patients who could be ill or seriously ill with or without COVID from visitors that may or may not know that they have infection. And so what we have at this point are visitation policies that limit the number of visitors. In many cases, no visitors are allowed, and in some cases, exceptions to that may be made depending on any individual healthcare system under certain circumstances. The end result of that is that we are needing to be as creative as possible in making sure that while we have social distancing, that we don't have social isolation in our patients. And our service has been working incredibly hard with it and a comprehensive team to ensure that we don't have patients who are socially isolated. The current environment, which I'm sure that many of you are aware of, is that we currently, as of yesterday, have 14,578 cases of COVID-19 confirmed in the state of Georgia per the Department of Public Health. And what we are seeing is that right now we have about 19.6% or close to 20% of patients who are dying of COVID. The good news is that means that 80% of patients are living with COVID and are recovering. And no matter if you are a patient that's going to live and recover, or if you are somebody who is not going to recover, our goal is to ensure that every patient is connected to their family and loved ones throughout this process. What we're seeing in social distancing, as we see in our communities, is that we are not able to congregate in the same way. And so the ability for us to bring multiple family members together and to be able to see their loved one and combat the idea of isolation while having distancing such that people are feeling connected is principally something that we're focused on here at Emory.
Dr. Quest, can you go into a little bit about how we're actually delivering on that?
Yeah, thank you, Susan. So we've got several modalities that we're using. In the hospital, Emory is using a baby monitor technology, which allows for a baby monitor to be in a patient's room and the receiving portion to be outside of a patient's room, such that it's much easier for them to connect with their nurse, with their care team, without the necessity to go in so frequently if the patient simply wants to be connected by voice to their care team. Of course, we enter the room at all times when needed to meet any care needs, but the baby monitor technology is incredibly innovative, a way in which we can easily make sure that patients are able to have sustained conversations. And we've seen some incredible connectedness with that. We've seen our spiritual health clinicians, our chaplains be able to support our patients in spiritual support. We've seen our social workers be able to supply social support, and of course our nursing and healthcare team be able to do that. The other modality that we're using is video conferencing, and so iPad technology or smart tablet technology, where we have a tablet in the room with the patient, so the patient has video capability, and then we are connecting and teleconference that patient to their family, to their loved ones across the globe, whether they be, we connected somebody last week from the UK with their family who was sitting here in our intensive care unit at Emory University Hospital. Today, we are going to be connecting a patient with their family. There's an Easter concert that the patient really wanted to be present for, but was unable to, and we are going to be broadcasting that concert with the patient and their family present so they can participate in that. And so those are two of the innovative ways in which we are focusing on making sure that patients are able to connect with their family. The other thing that we're doing is we're making sure that families at home are able to connect with the care team. It is typical that if somebody was ill in a hospital, that they would come into the hospital, that they would be able to talk to the doctors, nurses, and all the therapists and other care team members that are taking care of the patient, to be able to ensure that they understood clearly what was going on with their loved one. And we are using that video conferencing technology to connect the patient, the family, their caregivers at home, along with our clinical caregivers. So the ICU doctor or the hospital medicine doctor or the infectious disease specialist or the physical therapist, all of these team members are able to connect in with video conferencing technology. And with those strategies, we're seeing that families are less fearful about what's happening because they are able to just not hear but to see. So it is superior to just telephone communication. We're using that to make sure that our patients are able to communicate with their care team along with their family. As you might imagine, a family conference, anytime something was happening and you would typically be waiting for the care team to round or to see your loved one. In this case, we're able to do that through video conferencing.
Great, thanks, Dr. Quest. We have a couple questions. We'll start with the first one. How many patients are using the baby monitoring technology?
Currently, as of several days ago at least, we had several hundred baby monitors in every critical care room in our hospitals, plus other rooms are outfitted with the baby monitor technology. And that has been something that our critical care units have taken an aggressive lead on making sure that every patient can have access to that, as well as our patients who are on our general patient care floors.
Great, another question about the baby monitoring. With the baby monitoring technology, the loved one not in a hospital room, where can they be to communicate? Inside the hospital, outside the room, or outside the hospital?
So the baby monitor technology is mostly a technology that we are using for the care team communicating directly with the patient. Though what we have seen is the ability to hold a telephone up to the baby monitor so that someone can actually talk with their loved one. It can be very difficult depending on somebody's clinical situation to hold the telephone or talk on the telephone as from the patient room, but it can be very easy for them just to talk naturally, just like you or I are talking right now. And so they can speak into the room. The baby monitor technology is outside of the room, and you can hold the phone to that monitor so that someone can actually be able to communicate in that way. When we are able, as much as possible, we use the video conferencing technology so that people can interact directly and, most importantly, see their loved one. We know that hearing is one of the senses, but our visual sense and being able to feel reassured because we can see something visually happening is also something that we promote. So we are absolutely using the baby monitor technology along with the video technology to keep people connected.
All right, Dr. Quest, what type of feedback are you getting from families of sick patients who are now able to communicate with their loved ones? And what does that mean to you and the members of the medical team?
So the number one, I think, feeling, the pervasive feeling that we're hearing from families who are not able to see or connect with their loved one is fear of the unknown. And when the feedback that we're getting is that use of these technologies and strategies to communicate really helps calm fears, allows for them to feel much more in control. So one of the side effects of a pandemic is that there's uncertainty and fear and loss of control. And so the ability to be able to be in control of something, which it could be a communication, is something that can be reassuring. We are hearing families feel much more reassured because they have the control to be able to see their loved one. And we often know that our minds can imagine something far more devastating than what actually might be happening. And so for many, many family members, being able to see their loved one, they may have pictured something far worse that they think might be happening than is actually happening. And so having that reassurance and that fear lifted is amazing. One of the things that we've seen, a personal story recently, is that we had a case where by phone, a family member was actually calling our critical care unit every single hour. And as you can imagine, while the care team was trying to respond to those calls, you find that really that loss of control, that panic, that need for reassurance, with a video teleconference, we were able to resolve a lot of that fear, allow that family member to see their loved one, allow them to then move into a space of being able to talk with them, and we were able to help them not only get on a schedule that was more reasonable for them, because you can imagine calling a unit every hour can be very distressing to them, but they were able to say they felt so much better, they felt relieved, they felt that their loved one was getting the absolute best care, and we were able to reassure that with a video conference. So that's an example of being able to resolve some fear. The other thing that another story that I'd like to share is we were able to, we had a patient who was seriously ill, who was with COVID, who was able to very clearly communicate with her family, her children, her grandchildren from all over the nation, her desires and wishes, were she to get more ill, and to be able to very clearly have a communication of what was important to her, what things she wanted for all of her children, what things that she wanted for her grandchildren, And what we're being able to see here is that being able to have those meaningful experiences, you cannot cannot really replace those types of things. And to be able to hear it from the patient's voice, not just something that we said this patient said, but this patient is actually saying that, has been very fruitful and meaningful. And we've gotten very positive feedback from families to be able to have had that kind of interaction. And this family in particular was incredibly grateful to the team for being able to have that that sort of communication happen across multiple states with multiple children and generations, and even the dog being able to participate in the meeting and the interaction. The other thing that we've seen when we do our teleconference is our families are able to bring in anybody that they wish. So we've seen their pastors join. We had a patient on Easter Sunday where the pastor joined and they had an Easter service as a family. And that was incredibly meaningful and something that we would not want to ever deny somebody the opportunity to have. And so it's been those are some examples.
All right, let's, next question. I've heard of nurses using their breaks to help people to talk to their loved ones, and nurses and doctors using creative and compassionate ways to help loved ones connect. Can you speak of the compassion of medical workers to help patients who may be critically ill?
Thank you for asking that. So the providers that walk in the building every day during COVID-19 are fully engaged and ready to support patients and families in a way that they had these skills before, but are using heightened skills, if you will. So one of the things that we are seeing is that we're seeing nurses who are creating different types of ritual in caring for their patients. So we are seeing that while we always had patient and family centered care, one of the pieces that we always had at Emory was patient family rounding with our clinical teams. And so we are seeing that people are creatively still trying to have those rounds with their patients and families. And so being very proactive in communication. So one strategy that we've seen in one of our units work very well is that families have scheduled times when they can absolutely expect updates from their team so that we reduce the uncertainty and increase the predictability, and that we're using that time to not only communicate medical facts, but assess what sort of other needs are there. And that patient's bedside nurse is the central conduit to what's happening with that patient, given that they're spending the majority of time with those patients. And so being able to tell stories about what's happening with that patient and to bring things to life for that family member who may not be there is really important. And so that patient family centered strategy that we've always had, our nurses are continuing to bring that to the bedside through predictability, reducing uncertainty, and again, use of all of the technology that we have at our fingertips to facilitate those interactions.
All right, great. Do we have any more questions? Okay, Dr. Quest, do you have any final words that you'd like to share?
So I'd like to talk a little bit about how this has changed healthcare. So what we are seeing is that all of the technology and creative strategies that we're employing now, we believe are going to be durable after COVID-19. When we see the future, we've always had barriers to loved ones being able to get into the hospital. So a typical scenario might be that we have a family that works in the daytime, doesn't get home until the late evening, and then rounds for the clinical rounds for the patient when all the care providers are mostly there, might be in the middle of the day when that person is working, and they come in the evening and they feel like there might be a lack of communication. So we see that that's a very frequent scenario in a hospital, that whenever you are trying to get your healthcare needs met, you're constantly trying to coordinate communication with your healthcare team. What we see as a potential innovation as we keep moving forward in our video technologies is that we are not going to have the same geographic or time barriers, that we feel that we're going to be able to pull people in during the day simply because they don't have to travel. They will may be able to meet with their care team, their loved one's care team during a break. Or we also see in referral centers that people can be hours away from their loved one because they need the very necessary care. We know that this is unprecedented. We are in an unprecedented time period, but we believe that the strategies to connect patients and families are going to be around for many years to come. Thank you.
Thank you, Dr. Quest. If we have no more questions, we'll go ahead and wrap up. We will be sending the recording out as we have done previously within the next 10 minutes or so. And then stay tuned for information on our next briefing for Wednesday for Friday at 10 a.m. Okay, thank you everyone for your